Hello and welcome to the video about advanced care planning at UCSF called What Matters Most. My name is Red Wing Kesar. I've been a nurse for over 25 years. Right now I'm the director of the palliative care program at Jewish Family and Children's Services here in San Francisco, and we collaborate very closely with many of the teams at UCSF, especially the outpatient symptom management service. You might be wondering, what is palliative care? I said I was a palliative care nurse. So let's start so that we're all on the same page with understanding that palliative care is not the same thing as end-of-life care. Palliative care is really about helping people through the most difficult times in their lives when they have serious illness, whether it's a chronic serious illness or an acute serious illness. Palliative care is about helping relieve the suffering that happens not just because of a disease or a diagnosis, but all the things that contribute to suffering, psychologically, spiritually, emotionally. Palliative care is provided by a team. There are usually doctors, nurses, social workers, chaplains, and in some cases, volunteers as well. What's really important to remember is that palliative care can be instituted and should be accessed at any time during a serious illness, from day of diagnosis onward. So many people unfortunately think that palliative care is really only for people at the very end of life, and therefore they say, oh, I don't really want palliative care, I don't really need palliative care. But the truth is, anyone who has a serious diagnosis of an illness benefits from having the support of a team to help them through all of the parts of us that suffer when we have illness. There are many studies across the United States showing that when people get palliative care concurrently with any kind of curative treatment, not only do they live better, but they actually live longer. Part of what I do in palliative care is to help educate people around topics that involve palliative care, and certainly advanced care planning is one of those topics. You're watching this video now probably because you haven't come to a workshop yet at UCSF called What Matters Most. And if you're thinking about coming to that workshop, this might be a good introduction. If you aren't able to come in person to a workshop, I'm going to walk you through some of the things that we talk about in those workshops today, and maybe you'll get started on your own advanced care planning, and maybe you will have questions that come up as you do this, as you watch this. Feel free to write down your questions, to contact your healthcare providers, or to register for one of the workshops once you've seen this video. Before we actually get into the details of what it means to create a personal, unique, value-based advanced directive for yourself, I want to read you a poem by a woman named Jane Kenyon. This poem is called Otherwise. I got out of bed on two strong legs. It might have been otherwise. I ate cereal, sweet milk, ripe, flawless peach. It might have been otherwise. I took the dog uphill to the birch wood. All morning I did the work I love. At noon I lay down with my mate. It might have been otherwise. We ate dinner together at a table with silver candlesticks. It might have been otherwise. I slept in a bed in a room with paintings on the walls. And I planned another day just like this day. But one day, I know, it will be otherwise. We do this work because all of us know that one day it will be otherwise. None of us can live forever. As Woody Allen tells us, none of us gets out of here alive. And yet, because we live in a culture that has so much fear of death, that has such a difficult time discussing end-of-life issues, issues of suffering, certainly issues about death and dying. Until more recently, we have become better at it. But in general, we live in a culture where it's still kind of a taboo subject. And yet, if we don't talk about how we might want the end of our lives to be, how we want to be treated, what's important to us, then certainly if we haven't had the conversation with anyone and we haven't written down our wishes anywhere, then it's not really likely that it's going to end up the way we want it. Often we say to people, if we don't know your wishes, there's no way we can follow them. It's so important that we think about these kind of things when we're still pretty healthy, when we're in our right minds, when we have the capacity to have really serious, in-depth conversations with our friends and our families and our healthcare team about what's important to us. Creating an advanced care planning document for yourself is more than just checking a box on a sheet of paper. So often in the workshops that we've been doing, people come to them saying, you know, I was in the hospital and I was about to have surgery and I was just handed a piece of paper and I had to very quickly think and check a box. Or else people have said they've been to presentations about doing advanced care planning where there was only 10 minutes to ask questions and they weren't able to go into any depth about it. There are many different kinds of documents that one can use as an advanced care plan. Part of what's confusing is that there are so many. They all have different names and different titles. People don't understand that they all mean the same thing. So an advance directive for healthcare is the same thing as a durable medical power of attorney for healthcare. They can be created by lawyers, by doctors, or by downloading a form online. There are many, many different kinds of forms. Here at UCSF, Dr. Rebecca Sidori has also created an entire website called prepareforyourcare.org that includes a very simple and understandable advance directive that you can fill out online. You can watch a video about that particular document, or you can download it and fill it out yourself. Rebecca, in her wisdom and putting together this website and plan for people, has 5 basic steps that she asks people to consider in creating their documents. And we'll go through these steps in a different way as well, but her steps on the Prepare website include choosing a medical decision maker, deciding what matters most to you in your life, choosing what level of flexibility that you want for your decision maker, telling other people your wishes, and making sure that you ask doctors the right kinds of questions. One of the reasons it's so important to put your wishes in writing is that if there comes a time in your life that something happens when you cannot speak for yourself, the only way that we can legally do what you want us to do is if we have a document that is a notarized or signed legal document that tells us what your wishes are. As I mentioned before, there are many different kinds of forms. Some of them are very simple and oftentimes really just have a checkbox that says, I either want life support or life-sustaining treatments, or I don't want that. There's a lot of gray area in between those two boxes. And often in medical situations, clinicians are dealing with that gray area because we don't really know who you are when you've filled out a document that's just a checkbox. For many years in my career, I was an intensive care nurse, and I ran an intensive care unit. And that was where I learned a lot about the gray area in advanced care planning and the things that people didn't speak about and didn't have conversations about that end up being the reasons why people stay in intensive care units for long periods of time, because nobody really knows anything about them. There were times in my nursing career in hospitals when I would call the person who is listed as an agent on an advance directive, and they would have no idea that they were that person's agent. And they also, when they understood what it meant, were very reluctant to make the kinds of decisions that needed to be made because they had never had conversations with people. Creating a document that's really meaningful to you, that reflects who you have been in your life, what's important to you, how you have lived your life, what really matters to you. That's what enables us to understand the kinds of choices that need to be made in these critical medical situations. So again, putting your wishes in writing that really express who you are, and having really in-depth conversations with the people who you choose to speak for you are the two most important things about creating a personalized and value-based advanced care plan. Yesterday, a woman in a workshop said to us she had had an intense diagnosis of leukemia 10 years ago, and she was disease-free now and very happy about it, and she had been putting off doing this paperwork for all of the last 10 years. And she said it was partly because she grew up in a Chinese culture, and that in her culture, no one wanted to talk about death and dying. Even when she was sick, people didn't want to talk to her about her disease process. And she said it was very difficult and scary for her to not have people that she could discuss her feelings with or her fears. Another woman in that same workshop then said, well, it's not just the Chinese culture. My husband's from Turkey. And when I was going through treatment, he didn't want to talk about my treatment decisions. He didn't really want to talk about my fears. And he certainly didn't want to talk about anything that had to do with the end of my life or death and dying. So many people in so many cultures within our culture come up against taboos and reasons why it's difficult to talk about these kinds of things. And yet, as we all know, having these kinds of choices in place before a crisis comes is an incredible gift both to ourselves and to our loved ones and those around us. Creating an advance directive for healthcare is about what happens if you cannot speak for yourself. Either you're just too sick, maybe you're not conscious, maybe you have some cognitive impairment, maybe you've had a sudden accident or trauma, and you can't express your wishes or speak for yourself. In that scenario, if you've created an advance directive and named agents to speak for you, they can then express your wishes. Before these kind of advance directives came into law in the late 1990s, we had a document called the Living Will. And that too was a document where people could state what their wishes are for medical care, especially at the end of life. But the difference between a living will and an advance directive or a power of attorney for healthcare is that now we have the ability to have someone else speak for us if we can't. So one of the documents that I like to use a lot is called the 5 Wishes. It's not perfect. I haven't yet found a perfect advance directive document. But what I like about the 5 Wishes document is that it's written in very plain English, similar to Rebecca Sidori's document online. It walks you through a similar 5 set of questions as Rebecca's, but slightly different. But the first one is the same, and it's really about who you choose to be your advocate, to be the person or persons who speak for you. You can choose a primary agent and a secondary agent. You can even have 3 agents if you'd like. What I often caution people about, however, is that a lot of times you automatically think the person who's going to be there to make decisions for you should be your spouse, your partner, your oldest child, kind of the most obvious person in your life who could handle that kind of responsibility. What's really important to consider is that if you are in a traumatic accident and suddenly you're in the emergency room and you can't speak for yourself, will the person who you're very closest to emotionally be having such a hard time that they can't really be objective and be a strong advocate for you because they're much too upset? It's really important that when you pick someone to be your agent, to be the person who speaks for you, that they are someone who can, in a crisis, step up to the plate, be objective, and really advocate for what you want. It has to be someone who's not afraid of talking to people in the medical world who sometimes seem like the authority figures. It has to be someone who feels confident that they've had enough of an in-depth conversation with you to understand what you would want in a situation of a critical illness or a critical trauma. And that they can say to the doctors and the staff in the emergency room or the intensive care unit that I'm the one who knows this person. I'm the one who she chose as the power of attorney for healthcare. We've had conversations. I know how this person has lived their life, and I know how they want the end of their life to be. So let's talk about how to proceed now and how to create a plan of care that's really going to be consistent with who this person was. The other important thing about choosing the right agent, and certainly you can make changes in any of these decisions at any time. If the person or people you choose move out of town, are no longer around for some reason, or you've decided there's a better person to make decisions for you, that's absolutely fine. You can change these documents at any time. In the 5 Wishes document, as in Prepare for Your Care, you also have choices about what kinds of decision-making you want to allow your agent to have. And there are a whole variety of things, including, decisions not only about the care that you're getting in the hospital, but maybe they should be the decision maker about the kind of care that you might need at home. They can also be the person who makes decisions about what happens after you die. Someone yesterday asked me about controversies that sometimes happen in families. We all know everybody has strong feelings about what to do when someone is sick. And sometimes family members arrive to a situation who haven't been involved in someone's illness or there to help them, and yet they have strong feelings about what should or should not happen. One of the things I always advise people is that when you choose who your agents are going to be on your power of attorney, make sure that you also tell other people in your life, especially family members who might feel uncomfortable that they weren't chosen. Let them know who you chose as your agents and why, so that there isn't controversy at a more critical time. You can also ask your agent to be in contact with whomever you want. All of these documents are really just outlines. Whatever you decide and whatever you write down today, you can also feel free to type up addendums If you have very specific things about who you are and what you want people to understand about you in this process, write them down. When your advance directive is signed or notarized, we then have you initial and date those addendum pieces of paper, and they're attached to your advance directive, and they become part of your legal document. I often use as an example a document that a patient of mine did some years ago. She had end-stage cancer, and she had been suffering for a long time, but had not wanted to have a conversation with her family about what she was going through. The truth is, in the end, it made it much more difficult for her daughter because she really didn't understand that her mother was close to the end of her life. And she had many more questions that then couldn't be answered because her mother didn't have the strength to answer them. However, in the last few weeks of this woman's life, after putting off doing her advance directive for a long time, she finally wrote an essay that was based on these questions in the 5 wishes, but very much just in her own language, in her own voice, describing who she was, what was important to her, how she wanted to be treated at the end of her life. One of the things she said was, "I do not want to be touched unless it's medically necessary, and unless it's a doctor or a nurse doing something they have to do, or unless it's by my daughter and my grandchildren." Now, none of us would have known that about her if she hadn't put it in writing, because most clinicians, especially most nurses, when you walk into a room and someone is ill, your first inclination is to touch them, thinking that that's going to be a comforting gesture. But this woman said, "That is not a comforting gesture to me at all. I don't want to be touched when I'm lying in a bed at the end of my life." Again, how would we have known? This woman was also humorous in an essay that she wrote about her advance directive wishes. And at one point, she says that, "I wish to have my family, my friends, and everyone else know that I forgive them for when they may have hurt me. Family, friends, and others does not include my third husband." You can maintain a sense of humor throughout illness, and as many of us know, laughter and humor is sometimes what gets us through difficult times in our lives. As you proceed through the 5 Wishes document, or your own essay, or the Prepare website, the other wishes that you're asked to think about are, what kind of medical treatment might you want or not want? This is the question that talks about what life support means to me. Life support treatment means any medical procedure, device, or medication to keep someone alive. A lot of times people think that life support is only about being hooked up to a ventilator, a machine that breathes for you if you can no longer breathe for yourself. But in truth, in medicine, there are lots of things that can keep people alive these days, and we have choices about them. Do you want to be kept alive with artificial nutrition and hydration? If you can no longer eat or swallow, do you want what we call tube feedings or artificial nutrition to keep you alive? Would you want to be in a hospital with IV medications and antibiotics if you had an infection? Would you want to be on dialysis if your kidneys failed? There are many choices around life support that we have, and if we already have a serious illness, we might think differently about what it means to be in a hospital and have invasive interventions done to us at the end of our lives. One of the things I always ask people to do in their homework for these workshops that we've been doing is to really think about and write down, what does life support mean to you? What does quality of life mean to you? We ask that question and we talk about it a lot in medicine about what is quality of life for you? What really is important? What does matter most in any given day, in any given week? If you have a serious illness, what are the most important things for you to do in the next day or week or month? Are there certain people that are important for you to see? Are there places you need to go? I had a patient one time who I was...
Let's pick that one up. So that was a good break right there. And tell your story about the patient.
Okay. I had a patient one time who I was doing a consultation with her about her end-of-life wishes with her and her 2 daughters. And when I asked her the question of what's most important to you, are there any things that you really want to have happen before you die, her daughters were kind of sitting on the edge of the couch, like wondering, what is Mom going to say here? And she said, I really want a hot pastrami sandwich from Max's Deli. Well, they just couldn't believe that their philosophical mother came up with this very mundane thing that was important to her to have happen before she died. And they were able to do it. They were able to go and get her the meal that she really wanted and craved, but they wouldn't have guessed that if she hadn't had that conversation with them. So what quality of life means, what life support means, is different for each and every one of us. It's okay that it's different. Some people feel strongly that they want to be kept alive as long as possible. And if that means living in an intensive care unit, hooked up to machines, but they're still here on this earth, that's important to them. And it's important for their agents and their loved ones to know that about them. There are other people who feel very clearly, I don't want any of that. I don't actually want to even be in a hospital when I'm at the end of life. It's most important for me to be home and in a peaceful environment and be taken care of. If you, like so many other people who have been questioned about this across the nation, feel that your preference would be to die at home and to be at home surrounded by loved ones and friends, it's important for your loved ones and friends to know that. But it's also important in this day and age to understand that in order to be at home at the end of your life, you need to have certain kinds of resources. Typically, those are about having people who can help you. Because when you're seriously ill and you are at the end of your life, you can't take care of yourself anymore, most of the time. You either need to have a very strong support group of friends and family who can show up at your bedside 24/7, or you need to have the financial resources to be able to hire people who can help out in that process. A lot of times we don't consider what the reality is going to look like when someone is seriously ill and how they can best be taken care of. For some people, they feel safest in a hospital. They feel safe knowing that there's a button they can push and a nurse will come and help them. For others, it's more safe to be in a residential care facility of some kind, whether it's a residential hospice or an assisted living where the hospice team is then coming to visit them. But again, they know that they have someone there around the clock to help them, and their families and loved ones can just show up to be their loved ones. All of these things are important considerations and important parts of the conversation to be had with your agent when you're talking about what matters to you and how you live and how you might want to be treated at the end of your life. So in the 5 wishes document, wish number 3 is about how comfortable you want to be. And this wish is a lot about physical symptoms and making sure that your pain is well managed, that your anxiety is well managed. But it's also about the kind of comfort that you might want in terms of the environment around you. Often people are afraid of using pain medication. I have heard so many people say to me, I don't want to go on hospice because hospice, when you go on hospice, you just get a lot of medication and you die right away. That's one of the myths about hospice care. Hospice is really palliative care in the last 6 months of life. The hospice Medicare benefit in our country states that if a doctor is able to say that it's likely that you will die within 6 months, then you can be enrolled in hospice care, and hospice becomes your medical team. It's an incredibly wonderful and helpful service. They are the best home health medical team that you can find. They're on call 24/7, so that if something happens to you in the middle of the night, there's someone for you to call. There are so many fears around hospice and ideas of why I shouldn't call hospice. But the truth is, the longer you're involved in a hospice program, the better it is, because you build a relationship with that team. They do get to know who you are. They do get to know what your wishes are. And they can help your family and your loved ones and your friends as well as you, because hospice, again, is a palliative care team. It's not just one clinician. It's doctors, nurses, social workers, chaplains, people to help every aspect of what's going on when you have a serious illness. So when you are considering how comfortable you want to be, it's important to consider who are the clinicians who are going to help manage that comfort. Maybe it's a hospice team. If not the hospice team, hopefully you have a medical team that can really work with whatever symptoms you have, whatever pain management needs you have, and fine-tune those things, because it changes over time, and you need to have a team that's flexible and responsive to your needs as your needs change. Again, your agent is often the person to make contact with those teams, so they need to know who those people are. The other issues around comfort, as I mentioned, what kind of environment do you want to be in? Even if you are in a hospital room or in a facility, you still get to have some choices about what's in the room with you. Do you want flowers? Do you want a painting on the wall? Do you want music to be played? Who are the people who you want around you? It's really okay to write down in your advance directive who the people are who you want at your bedside, and also who the people might be who you really don't want at your bedside. Because if you're going to be disturbed by the appearance of someone you're estranged from, it's really important for your agents to know that they can be a gatekeeper, and they can kind of help create the environment around you that's important for you. For many people, the end of life is a very special and sacred time. You know, I often talk about that death is not a medical event. It is a spiritual transformation, just as birth is a spiritual transformation. In this country, we medicalized birth for quite a while, and then the baby boomer generation had to reclaim the fact that birth is something that people have been doing for many thousands of years without being in hospitals. And there is a movement now to understand that when we are dying, we may not need to be in hospitals. We may be able to create the kind of space and sacredness around this time in life without a lot of medical intervention anymore. But we do need hospice teams and doctors who can help with pain and symptom management, because those often become issues that interfere with our comfort. So the last two wishes in the 5 wishes document are how I want people to treat me and what I want my loved ones to know about me. Often these are the wishes that people kind of have a hard time with, and maybe you're one of those people, maybe you're not. How I want people to treat me, like I said, can also be part of your comfort. Like this other woman said, she didn't want to be touched. Well, maybe you want to. Maybe you want your feet to be massaged. Maybe you want somebody to offer you sips of water or your favorite drink as often as possible. Think about what it means to have people around you trying to keep you comfortable and how you want them to relate to you. The last wish is about my wish for what I want my loved ones to know. In some cultural traditions, there's something called an ethical will, which is a way to leave behind not the material things of your life, but to leave behind who you were, what was important to you, what were the things that were most fun in your life, what were you most passionate about. What were the adventures that you had in your life that really inspired you? Who were the people that inspired you? Often, if we haven't thought about it ahead of time, there's suddenly not time to tell our families, our children, our friends, people who are going to come after us, the important details about how our life has been. And whether you do this kind of ethical will in writing, by writing an essay, by just putting down some bullet points about your life, some people do videos. At UCSF, there's also something called the Notes Project, where people will work with you, recording the things that are important for you. It doesn't have to be a really big deal, but it is often a big deal for those who come after you to have some remnant about your emotional or spiritual or psychological life that was important to you that they can then understand and carry on. There are actually a lot of tools these days to help us fine-tune our own documents for stating our wishes and to help us have conversations. This is a deck of cards called Go Wish. It was developed actually quite a few years ago by Dr. Betty Mencken, who was a palliative care doctor, who was ending up having a lot of conversations with adult children and their elderly parents. And she would find that they had very different ideas about what the parent might or might not want towards the end of life. And so she developed this deck of cards and this game called Go Wish. Having it be a card game sort of lightens up the conversation in some ways, but it's an incredibly effective tool. So on the back of each card is some kind of wish about what you might or might not want in your situation when you're seriously ill or at the very end of your life. It's things like, I want to be treated the way I want. I want to be at peace with God. There's a wild card for adding in anything that wasn't included in this deck. I want to be kept clean. I want to have my financial affairs in order. I want to feel that my life is complete. I want to have a nurse who I feel comfortable with. I want to be mentally aware. So you go through this entire deck, looking at each card, and making 3 piles. The first pile are the things in here that matter the most to you, that are absolutely critical and important. Then a second pile of things that, these are a little bit important but not critical. And then a third pile that's kind of your discard pile. Those things really don't matter to me. And then you go back to your first pile of the things that are really the most important things and try to narrow it down to the top 5 or 10 and then put those things in order. That way, you can have a conversation with your friends, with your agents, with your loved ones, where you can say, these are really the things that matter to me. When Dr. Mencken was developing this deck, she would give a deck of cards to the adult child and give one to their parent, and she would ask the adult child to cut the deck the way, say, she thought her father wanted it to be. And then she would have the father cut it the way he would want it to be. And invariably, there would be differences in what the child thought the parent wanted. But that enabled them to have a conversation of saying, oh my gosh, I thought these were the most important things to you, and now I understand that these are actually the most important things to you. You can bring these cards to Thanksgiving dinner. You can have a dinner party and have everybody have their own deck and play the game together. You can sort through it with someone, and you can use it as a tool with your agents to help them understand all of the kind of range of things that are important to you in this process. Doing this for yourself can also help inform how you write down your wishes for your own advanced care planning document. There are also many tools online these days. There are organizations called like the Caring Conversations, the Conversation Project. In California, we have the Coalition for Compassionate Care of California, whose website is CCCC, that has many, many tools for helping people fill out advance directives. And as I said earlier, at UCSF, Rebecca Sidori has created a wonderful website called prepareforyourcare.org that also helps you understand how to have these conversations and why they're so important. I really want to emphasize that as well as having your paperwork in order and signed and legal, it's just so critical to be having these conversations with the people in your life who are the people who are going to show up for you if you're seriously ill. Once you've completed the documents, you will make many copies of the complete document. It's important that you have a copy, that your agents all have copies, that really close people in your life maybe have a copy or at least know what your wishes are. These documents are not to be hidden away in a safe deposit box or somewhere where nobody can find them. They should be in a pretty obvious place in your file drawer, or your desk, or your house. Your doctor should have a copy. If you are part of a healthcare system, you should make sure that your document is scanned into your electronic medical record so that it's accessible. Doing this now, while you're still healthy, while you're still able, while you can really consider what's important to you, is one of the greatest gifts that you will give to yourself, but also to your family and to your loved ones. Having this paperwork and these conversations completed means that it's not a guessing game. We know what your wishes are, and that is how they will be followed. And it means that if you're in a serious situation in a hospital setting, the people who care about you are not going to be running around wondering what to do. They're actually going to know what to do because they've talked to you about it and they care about you and they want to follow your wishes. Please don't put this off any longer. If you have questions, there are places that you can contact at UCSF, or feel free to come to one of our monthly workshops. Thank you.